We can draw some insights about the space for innovations from looking at intermediaries. Obviously, pay attention to their data. They generally have lots, often from their work paying for care, but also sometimes from other efforts to track the characteristics of their members and their healthcare use and other things. Also note the variety of things that they're doing that they might be able to use help with. They're trying to do a bunch of things. They're trying to figure out which tools to use and how to use them well, which providers to contract with. Should they add new providers to their networks, drop some that they already have? Can they provide feedback to the providers in their network to help them improve their performance? How to design payment approaches and how to figure out which will be best in any given situation? How to figure out which of their enrollees are about to use complex medical care that they could possibly help before it happens? Which requests for pre-authorization they should approve and which not? Which hospital stays for their members are getting to be too long? How optimally to set cost sharing, and on and on. And they can have other goals and activities as well. In a marketing sense, private intermediaries have to figure out which employers or people might be their most likely customers and how to market to them. And we didn't talk a lot about it, but intermediaries also have to process loads of bills for medical care, claims we often call them, and figure out which ones to pay and which ones not, which have errors and which not, which might be fraud and which not, and other related tasks. And they have to do this in a complex environment that's affected by their niches in the market. Some plans may be quite focused on minimizing costs overall, for example, and look for tools to help with that. Others may face a reality that reducing costs too much is not their main goal, and they may want to focus more on improving provider or patient relations. So if you think you want to work with intermediaries, take a look at their activities and their niche, which can be very informative about what they might be interested in, and note that they're not all the same, but they all pretty much have a set of challenges they're facing, and therefore opportunities for innovation.